So when we talk about pharma industry and lab training in particular, how can they leverage VR as a technology or as an innovation?
So I think in any industry where people need to work with their hands, any industry where people aren't working at laptops every day, I think VR can help. If you take the pharmaceutical sector, people work in laboratories. These are extremely sterilized environments. They are wearing gloves again. Not the most conducive to using laptops. Or again, they'll have their own devices. They'll have their own screens, but it's not convenient, right? The promise of VR now is that we can take their existing workspace, the labs that they live in, those environments, and make a digital twin or a replica of that. Essentially, in VR, they can step into a simulation of the lab. Now, with pharmaceutical, one of the most common use cases for training, one of the most common trainings that occur is it's very important to ensure the environment is sterile for all the experiments being conducted there. With whatever equipment it may be, a key part of it is anyone who's interacting with these experiments or the equipment involved has to sterilize their arms before, after, and these are very defined, specific procedural trainings that they need to do, different for each equipment. And this is not just for the scientists who work in their labs. What about the technical people who come in to work on the equipment, maybe even to clean the space, etc.? They need to be aware of this and undergo these trainings. So in VR, what you can do is, instead of having a training manual or just documents where these steps are outlined, and sometimes these tend to be very technical. With VR, what we can do is we can take these documents, convert it into a VR experience where they are shown how exactly to do this, and they also have the freedom to, at their own pace, essentially do these steps one after the other. They can feel free to make a mistake, learn from it, and go through it as many times as they want. And once they're ready, complete an evaluation, they can be confident that they're ready to enter the workspace. What we have seen after deploying VR training for sterility assurance is that these incidents start reducing. It also makes people a lot more confident. It makes this workspace also a lot less intimidating and helps people across different profiles communicate with each other. So there is the tangible benefits of improved learning, but also these intangible benefits of just people have a greater understanding of what they need to do and why they are doing it.